Is everybody back, though?
Madam Chair,
Yes, Councillor Armstrong.
I'm just going to let you know that it appears my icons are not working, so I'll have to vote by.
Duly noted, Councillor Armstrong.
Thank you.
Your screen was flashing before, Les. What was that? It was going.
You're on mute, Les.
Yeah, I think that's the just the way the things behind me, the windows occur, depending on what's going on outside.
Okay. Colleagues, we're live. Thank you all for returning so promptly. So now I would ask Mr. Brubaker to do a roll call.
Thank you, Chair Redmond. Councillor Armstrong?
Here.
Councillor Clark?
Here.
Councillor Erb?
Here.
Councillor Foxton?
Here.
Councillor Galloway?
Here.
Councillor Harris?
Here.
Councillor Jaworski?
Here.
Councillor Jowett?
Here.
Councillor Kiefer?
Here.
Councillor Lawrence?
Here.
Councillor McGarry?
Here.
Councillor Nowak?
Here.
Councillor Shantz? Councillor Shantz?
I think she's frozen
I was
again.
going to say, I can see your video, but she's frozen. We'll come back. Councillor Strickland? Councillor Verbanovich?
Here.
Chair Redmond?
Here.
Councillor
Here.
Shantz, can you hear us now? That's all present except Councillor Strickland and her. We're not able to see Councillor Shantz, so we'll work on that from the technical
Sandy,
side.
if you can hear us, you're frozen. Maybe go out and come back into the meeting. Council, I will welcome everyone to our electronic Board of Health meeting. Due to the COVID-19 pandemic, Regional Council as the Board of Health is practicing physical distancing and the councillors are participating electronically. It sounds like we heard from Councillor Shantz. I will now entertain a motion to reconvene in open. That is moved by Councillor McGarry, seconded by Councillor Nowak. All those in favor, please do so. Councillor Armstrong, I will look for you to raise your physical hand. That is carried. Councillor Erb, do you have a question? Okay, you're just raising your hand. That's great. Thank you. This is a verbal update for public health. Before we start, are there any declarations of pecuniary interest under the Municipal Conflict of Interest Act? Seeing none, we will continue. So welcome, Dr. Wong. The floor is yours to give a verbal update on COVID-19.
Thank you, councillors, Chair. Thank you for the opportunity to give an update. And Kathy Prosh will be forwarding the slides on my behalf. So if we go to the next slide, which is entitled Key Messages. We are in a serious situation in Waterloo region. The spread of COVID-19 has escalated rapidly. We are speeding fully into the red zone. If we do not make major changes now, we will continue towards the lockdown zone. Therefore, starting today, we need to dramatically reduce our social interactions. What do I mean by that? Two things. One, we need to stay home and only go out for essential purposes, such as going to work, school, getting groceries, keeping a medical appointment, or getting essential physical exercise outdoors. Two, we need to limit our social interactions to only those within our own households, which can include one or two essential caregivers or essential supports for someone who is living alone. This means we need to avoid social interactions with friends, with coworkers when not at work, and with extended family outside of our households. I am asking all Waterloo Region residents to help our community through the personal actions that we can each take. If we choose to act now, before it gets worse, we can mitigate the period of time we will be under significant restrictions. I don't want to raise false hopes, though. Because of the choices we've already made, which are being reflected in our rates today, we will undergo a difficult period of restrictions. Our trajectory is already in motion, like that of a speeding train, towards the red zone and beyond. But we can all make a choice, starting today, to slow that train, stop it, and make it start going in the opposite direction, towards green. If we go to the next slide, please. Current status. Last Friday, Minister of Health Christine Elliott said, over the last week, we have seen an alarming shift in the trends of key public health indicators in regions across the province. Definitely seen this in Waterloo Region. Our case rates have more than tripled within the last 2 weeks. Our outbreaks have rapidly expanded in size and complexity. Our hospitalizations have increased significantly in the last few days, and an increase in deaths will start to follow. Rising case rates are only the tip of the iceberg, what we see first. When a large number of cases appear in multiple settings, this leads to multiple clusters and outbreaks in various settings, which leads to further cases in even more settings, which leads to even more clusters and outbreaks in those settings. This leads to broader and faster community spread. This is what COVID is like. It can accelerate, and it has accelerated exponentially in our region. Due to what we've seen in the last week, Waterloo Region residents should consider COVID-19 to be widely circulating in the community right now. If you have symptoms, do not go to work, do not go to school. Self-isolate and make an appointment to be tested. Testing appointment times are easy to obtain right now. There is capacity, and testing turnaround times are good. So please, go get tested if you have symptoms. If we go to the next slide, I would like to spend a few moments to review recently released provincial trends and modeling because of the important context that it provides. Key indicators of the pandemic continue to worsen. Although the impact can vary significantly across regions in the province, most indicators are moving in a worsening direction across most of the province. Waterloo region right now, unfortunately, is one of the fastest surging areas in Ontario. What the experts have shown is that all countries that Ontario is comparing itself to have struggled to control spread after allowing strong growth in case numbers. And they are all in lockdown today. At a 5% rate of growth, which is considered a reasonable estimate of where the province is right now, our provincial case numbers will likely exceed those of several jurisdictions in Europe that are now in some form of lockdown, including France, Germany, and the United Kingdom. As many of us likely heard through headlines, by mid-December, Ontario could see 6,500 cases per day, which would equate to proportionally around 260 cases a day in Waterloo region, if we do not grow faster than the province. Unfortunately, right now, we are surging, and our case growth is outpacing that of the province as a whole. So we could see significantly higher numbers than that. Provincial experts have indicated as community spread increases, the number of cases for which we will be able to identify the source will decrease. As cases keep rising, it will be harder and harder to track all cases, and priorities will need to be placed on tracking the most important cases. The province has seen substantial growth in the percent positivity in older age groups in more recent weeks. If this age spillover from younger to older age groups continues, provincially, we will see hospitalizations grow at an even faster rate, followed by climbing mortality. Cases of long-term care continue to accelerate, and long-term care home resident mortality is increasing each week. The key message that I would like to pass to you from the recent provincial update and modeling, based on the science and the expert opinion of the modeling experts and what we have seen in other countries, the later one intervenes in the epidemic curve, the harder it is to get the case growth under control. If we go to the next slide, please. This past Friday, the province lowered the thresholds at each level to adjust to the faster rates of growth across the province. I know it's hard to read off this slide, but this slide deck, which will be available later, shows the new thresholds for each color category. As you are aware, we were placed under the orange category last Friday, effective today. If we go to the next slide. At the time, late last week, when Waterloo region was moved into orange, our indicators were both in the new orange and the new red categories. Given the trends in the last week overall, and especially in the last 3 days, we are clearly moving into the red. We go to the next slide, please. We therefore need to be prepared to move into the red zone. What does it mean to be in the red zone? If we go to the next slide, please. Some examples of additional restrictions that would be on top of those in the orange zone. For restaurants, bars, and other food and drink establishments, in addition to all the measures from the orange zone, key changes include the maximum number of patrons permitted to be seated indoors will be 10. Outdoor dining, takeout, drive-through, and delivery will continue to be permitted. For sports and recreational facilities, in addition to all the measures from the orange zone, key changes include the limits for gyms and fitness studios will be 10 people indoors, 25 people outdoors. All sports and recreational programs and other facilities will be limited to 10 people per room indoors, 25 outdoors. Team sports must not be practiced or played except for training. Therefore, no more games or scrimmages would be permitted. If we go to the next slide, please. For meeting and event spaces, in addition to the measures from the orange zone, key changes include 10 people per facility indoors, 25 people outdoors. For retail, in addition to all the measures from the orange zone, key changes include maximum number of patrons permitted to be seated indoors in the food court is 10. The government is also considering for the winter holiday season limiting capacity in retail stores and shopping malls. Finally, a couple of additional examples on the next slide. For personal care services, in addition to all the measures from the orange zone, services requiring removal of face coverings will be prohibited. And for the performing arts facilities, in addition to all the measures from the orange zone, key changes include they would be closed to spectators, although rehearsal or performing a recorded or broadcasted event remains permitted. If we go to the last slide. Even before we are officially moved to red, I am asking all Waterloo Region residents to help our community through the personal actions that we can each take. This slide is a reiteration of the key messages. Starting today, we need to dramatically reduce our social interactions. 1, we need to stay home and only go out for essential purposes. Try to also limit the number of people from your household going out for those essential purposes. 2, we need to limit our social interactions to only those within our households. This means we need to avoid social interactions with friends, with co-workers outside of work, and with extended family outside of our households. Our personal actions are the biggest determinant of COVID spread. And our choices of how we interact socially will determine if we control COVID or if it controls us. Throughout this pandemic, Waterloo Region residents have shown they are willing to step up and do what it takes to beat COVID and help protect one another. We can all make this choice ourselves before we have no other choice, and before too much damage will be done to businesses, livelihoods, and lives. Please, let's limit our trips outside to essential purposes and cease all social gatherings. We need to do this now, and we can do this together. Thank you.
Thank you, Dr. Wong. As Dr. Wong has stated, the spread of COVID-19 is on an exponential rise in Waterloo Region. We all have a role to play to reduce our social interactions. If you were to receive a positive COVID test today, how many close contacts have you had that public health would need to follow up with. Have you been diligent in wearing a mask and socially distancing? So those contacts could possibly be considered not high risk. Earlier today, I wrote to both the Federal Minister of Health, Minister Patty Hajdu, and the Provincial Minister of Health, Minister Elliott, urgently requesting trained and skilled contract tracers to assist our contact tracing and investigation efforts. With each case and outbreak, we are seeing a very high number of contacts that require hours of contact tracing by public health officials. We can't do this alone. We need all levels of government's assistance to increase our contact tracing capacity. The region also reached out to the province for help, and starting today, for the next few weeks, we have a provincial multi-ministry task of almost 30 provincial offenses officers across the region to carry out education and enforcement of high-risk businesses where we are seeing spread and where guards are being let down. This supports current efforts to build awareness and ensure workplaces can stay safe and stay open. We've seen too many outbreaks in employee settings where COVID is spreading from worker to worker. We need a stronger compliance by workplaces to enforce the requirements of wearing masks, socially distancing where possible, hand washing, and staying home with any symptoms. As Chair of the Public Health, I have instructed staff to increase our enforcement efforts and utilize the tools that are available to enforce, including the reopening of Ontario Act and our regional mask bylaw. I see we have some questions. Councillor Foxton, go ahead.
Thank you, and through you, the chair, to Dr. Wang. So I totally agree with what you're doing. I have to say this publicly. And ladies and gentlemen, we have to step up, all of us, because this is our new lifestyle for now. And the more successful we are, the freer we'll become. But Dr. Wang, we also still have to show social tolerance and kindness to those who can't mask or who have decided not to mask, rather than be confrontational. I believe, is that correct?
Dr. Wang?
I might pass that question over to our enforcement leads, because they enforce the bylaw related, the bylaw as well as the provincial legislation related to masks. So I'm just trying to see if I can see Chris or Tom. Tom, would you be able to answer?
I see Chris. I don't see Tom or Aldo. Chris?
Oh,
There's
Tom's
Tom.
back.
Hi.
Go ahead.
Sorry, what was the question specifically?
That we should be social tolerant of those not wearing masks or those choose not to wear masks, correct? Because we don't want it to be confrontational.
No, we definitely don't want people confronting other people about it. I mean, there's medical privacy regarding this issue, and that is the preferred line regarding how citizens should react to each other about it, and ourselves as enforcement officers.
Thank you. But
yeah, I would just maybe add,
go ahead.
I would maybe add that the provincial and the regional legislation, the exemptions for the provincial and regional legislation for the wearing of masks is if someone cannot do it for health purposes, not if they don't want to do it.
Thank you, Dr.
is
Wayne. So that clarifies that. But I would also like to sort of say that if you do have health issues, please, please, please stay home and be safe, because I would hate for someone to give it to you. But again, I think our society has to be socially tolerant, take care of ourselves and wear our masks and keep ourselves safe and hope that others will do the same for themselves. So that was my only concern. Chris Fletcher has her hand up.
Mrs. Fletcher, go ahead.
So just in response to that, I think one of the things to ensure that the public understands is if they see something is not to enter into that confrontation themselves. So to call the regional call center, 519-575-4400, and lodge their concern or their complaint with respect to the incident that occurred, but not to take it on themselves to try to enforce a particular, whether it's the provincial legislation or whether it's the face covering bylaw. So again, I mean, I think it's important that we do show that level of kindness to people who can't wear a mask. However, for medical reasons. However, if there is a concern, to make sure that they put that in the hands of the officials so that enforcement is done appropriately and they're not putting themselves at risk.
Can I ask that when we Facebook and tweet our messages out, that we always include that phone number for people to use so that they're well aware of it? Because I don't think a lot of I know all of us are, but I don't think a lot of the public may be. And I think that may be helpful for them.
Well,
So I totally, Dr. Wang, great job. We know we have to do this. I'm shocked by the numbers. So, ladies and gentlemen, we just have to do this. Thank you.
Thank you. Councillor Jaworski.
Thank you, through the chair. Thank you very much, Dr. Wong. As you've stated, outdoor exercise is certainly welcome. It's good for people's physical health, for people's mental health. And it seems to me like today you've sort of given a crystal ball view that red is coming for minor sports, for fitness studios, to racket clubs, just to indicate that, you know, for people who participate in those sports that, you know, things will be changing formally in the near future. And you're kind of giving a heads up to everyone saying that this is coming. And so can you just help me out with, for parents, what would be your message to parents who have kids in minor sports in the coming week, and what's probably going to happen, or what they should do? And maybe it's, as you've said, go for a walk in your neighborhood with your own household, and that keeps things safe. Could you comment on that, please?
Yes, thank you, Councillor Jaworski. Exactly as you said. So given our high case rates and the significant spread that has occurred in our community, I really recommend that people only socialize with people within their own households. That can include 1 or 2 essential caregivers, or if they're alone, 1 or 2 essential supports, but only within their household, so not with other families, and that they only go outside of the home in order to do essential functions, such as going to the grocery store, you know, going to a medical appointment, and going outside for essential physical exercise. I don't recommend that people participate in gatherings with other people, other families that are not essential and that are outside of their immediate family circle.
Thank you, Dr. Wong.
I see no further speakers or questioners. Just looking to make sure Les isn't waving his hand because his icon wasn't working. Okay, colleagues, thank you. Thank you, Dr. Wong, for this update. I know there is more to come, and on behalf of Council as the Board of Health, Council as a Regional Council, as well as the 600,000 people we represent, thank you to you and your team for working so diligently, not just locally, but I know that you're very active provincially in carrying these messages forward on behalf of our citizens and everybody in Ontario. Very much appreciated. So I would now, Councillor Lorentz, do you want to speak? Oh, he's giving you applause, Shuli. So Councillor Lorentz is going to move that we adjourn, and that's seconded by Councillor Erb. All those in favor, please use your icons. Thank you, and stay well, everybody.